그런데 우리가 만나고자 하는 의사 한 분은 명석한 두뇌의 킴 윌리엄스 박사입니다. 그는 미국에 본사를 둔 비영리 의학협회인 미국 심장학회 최초의 비건 완전 채식인 회장입니다. 그는 이런 유명한 말을 했죠. 죽는 건 개의치 않는다. 단지 내 잘못에 의한 것이길 원치 않을 뿐이다. 윌리엄스 박사는 우리의 건강에 해로운 음식들로 육류, 유제품, 달걀 및 다량의 정제 설탕의 섭취를 언급했습니다. 그는 자신의 심오한 발언이 언론에 그렇게 긍정적인 평판을 얻을 것이라고 기대하지 않았습니다. 수프림 마스터 텔레비전은 미국 뉴욕 멜빌에서 2018년 2월 2일에서 11일에 열린 건강에 관한 진실 10일간의 무료 컨퍼런스에서 윌리엄스 박사를 인터뷰하는 영광을 얻었습니다.
I'm Dr. Kim Allen Williams. I'm Chief of Cardiology at Rush University in Chicago and past President of the American College of Cardiology, and it's my pleasure to be here. Thank you.
Dr. Williams, how does it feel to be recognized as the first vegan president of the American College of Cardiology?
It was really quite an honor. It's like the pinnacle of the cardiology career. It's a wonderful accomplishment. I thought I would be known as the first African American or the first former professional tennis player, but that's not what happened. Ended up being the first vegan cardiologist.
윌리엄스 박사는 비록 이전에 스포츠의 경험이 없었지만 15살 때 일리노이주의 단식 테니스 선수로 3위가 되었으며 그 이전에 10대 체스 챔피언이었습니다. 그러나 그는 결국 자신의 진로로 의학을 선택했습니다. 2003년 윌리엄스 박사는 혈액 검사에서 높은 수치의 LDL, 즉 나쁜 콜레스테롤이 밝혀지자 즉시 동물성 식품 섭취를 포기했습니다. 그때부터 이 훌륭한 의사는 채식 식단이 심장병을 위한 최고의 치료법이며 예방법이라는 인식을 높이기 위해 열심히 노력해 왔습니다.
So, Dr. Williams, do you think plant-based nutrition should be the most important way to treat the patients with chronic diseases?
So if you're talking about cardiovascular disease, we would say absolutely. That is the thing that can have the impact the most, the quickest.
동맥경화증으로 알려져 있는 심장병은 대부분의 나라에서 가장 심각한 공중보건 문제 중 하나입니다. 미국 심장협회가 발표한 최근 통계에 따르면 미국에서 약 8,400만 명이 모종의 심혈관 질환으로 인해 고통받고 하루에 2,200명이 사망하며 평균 40초에 1명꼴로 사망자가 발생한다고 합니다. 미국에서 사망하는 3명 중 1명은 그의 동맥경화증 때문입니다. 이 질환과 뇌졸중에 들어가는 직간접 비용은 미국에서 연간 약 3,150억 달러에 달합니다. 당뇨병, 비만, 부실한 식사, 신체활동 부족, 흡연, 알코올 섭취는 동맥경화증의 위험을 증가시킵니다. 미국에서 심혈관 질환은 암이나 만성적인 호흡기 질환, 그리고 사고에 의한 사망을 합한 것보다 더 많은 사망자를 초래합니다.
Welcome back to our program. Dr. Kim Williams, the American College of Cardiology's first vegan president, part 1 of 2. Ms. Pak has more for us from the interview with Dr. Williams, a hero who is improving public health in the U.S. Let's join her now.
윌리엄스 박사는 자신이 어떻게 미국 심장학회의 회장이 되었는지 흥미로운 이야기를 우리에게 들려줍니다. 자세한 이야기를 들어볼까요?
It actually started very interestingly enough with one of the ACC staff members who saw that during our ACC meetings I was trying to get vegan food, and she said, well, why are you doing that? And I talked about, it's hypertension, diabetes, cholesterol, heart attack, stroke, and death. Other than that, no problem. And so she said, well, that really would make an interesting story. Can you please help us write it up and we'll put it in the ACC blog? And I said, well, okay, it's kind of personal, but all right, I'll do it. Then that got picked up by MedPage Today, and then that got picked up by the New York Times. And the next thing you know, I'm known as the vegan cardiologist for the United States. There actually are other vegan cardiologists, and it's growing pretty rapidly. But anything that I can do to help cardiologists lower their death rate, because the leading cause of death in cardiologists is still heart disease. So I take it very seriously, and I'm hoping that we can do this.
So Dr. Williams, why do you think many doctors are just pushing one more pill to a heart problem and not really working toward helping their patients toward the vegan diet?
The problem is that they are taking the statin, they're not exercising. A few of the cardiologists are smoking, very few. But I remember being in the 80s and being smoked out of the room during my cardiology fellowship. That was 20 years after the data was very clear, and it was still happening. So it takes time. It takes time to change behavior. It takes people growing out and having bad experiences. And I've had a number of them, talking about friends of mine in cardiology who've had heart attack or sudden cardiac death. It's time to stop, but it won't stop until we get the message out to everyone and make it very clear that they can make a difference for themselves, their family, their patients, their institution, and we'll stay at it.
이 훌륭한 의사는 러시 대학 의료센터에서 비건 완전체식 식단을 치료 방침으로 삼으면서 이후 자신의 심장병 환자들이 더 이상 의료센터에서 검사나 치료를 필요로 하지 않는다는 것을 발견했습니다. 이는 심장병 같은 만성 질환을 앓고 있는 이들이 지속적으로 내원하는 일반적인 경험과는 상당히 다른 결과입니다. 윌리엄스 박사님이 더 자세한 설명을 하십니다.
Now, the downside is you don't get as many stress tests and coronary angiograms and stuff, because those people, once they're vegan, you're done making revenue off of them. But we have to have a plan, and the plan is organic growth. That is, we actually partner with other institutions to help do their complex procedures, and we go to new places all the time. We're seeing people in retirement facilities or smaller hospitals, opening new offices. We're just increasing the rush footprint, and that way we get new people to fix, because once we fix them, we don't make any more money. It's hard to stay in business. Can't do it off a repeat business when you have vegan patients.
직업에 관한 얘기를 나눠주시고 동맥경화증의 예방과 치료에 관한 관점을 친절하게 알려주신 킴 윌리엄스 박사님께 감사드립니다. 우리는 또한 의료계 안팎에서 채식 식단을 장려하고자 헌신하고 계신 박사님을 높이 평가합니다. 킴 윌리엄스 박사에 대한 더 자세한 정보는 다음을 방문하세요. doctors.rush.edu. 다음 주 월요일 12월 3일에 방영되는 킴 윌리엄스 박사 미국 심장학회 최초의 비건 회장 최종편도 꼭 시청해주세요. 2부 최종편에서 윌리엄스 박사는 예방의학의 중요성뿐만 아니라 정부의 건강 지침과 비건이즘, 완전 채식주의에 대해 논할 예정입니다.
Do you think the vast amount of chronic diseases are due to the nutrition and current food choices of the people?
So it's very clear that our food choices have a tremendous impact. And, people will try to make estimates. Oh, it's exercise is 20%, 80% diet. That's probably about right. But I think we really shouldn't underestimate the impact of diet. You can't exercise your way out of a bad diet. You probably can do a better job of dieting your way out of a poor exercise pattern.
What would you say to the doctors who do not promote or advise their patients to adopt a plant-based diet?
It's really the same issue. That is, what is going to happen to you personally as a physician? You are going to become a patient. Are you going to try to work on prevention? And are you going to change your life and your practice to become more prevent-driven and less event-driven. Don't wait until something has happened. Don't wait to, identify the plaque and then you're going to attack it. Why not prevent it? And that can be done with lifestyle. I'm hoping that every cardiologist would be influenced to look at prevention more seriously. Good news is the American College of Cardiology now has the section on prevention, on lifestyle, that we should be doing to decrease cholesterol, to decrease blood pressure, to decrease risk, fixing it with lifestyle first.
미국 정부 기관인 미국 농무부 USDA는 미국을 위한 영양 지침을 정기적으로 발표하는데 미국 심장학회와 같은 관계자들은 요청을 받아 그 문서의 내용에 대해 조언을 합니다. 윌리엄스 박사는 미국 심장학회가 이 활동에 참여하는 것에 대해 자신의 생각을 나눴습니다.
Well, I would say that the government recommendations are improving and that we're trying to have more of an influence on it. And it would be great to be at the beginning of the process. And, they actually have nominated some of our members to the next panel for the 2020 guidelines. And hopefully we will have a greater recognition of the need for plant-based nutrition.
최고의 영양 섭취 방법에 대해 의료계 전체의 공감대 형성이 필요한 시점입니다. 환자를 위해 동물성 없는 음식 섭취를 옹호하는 윌리엄스 박사 같은 존경받는 의사들의 노력은 왜 육류와 유제품을 식이권장 상황에서 빼야 하는지를 이해하는 데 도움을 주고 있습니다.
Do you think the medical doctors should be given more training and new information about the impacts of nutrition on our health?
It really is key to have the providers impacting their patients by being knowledgeable about nutrition. We struggle with this because it's classically not been part of the medical school curriculum, and it's not in internal medicine and cardiology, but we're trying to get that changed.
일상의 업무에서 윌리엄스 박사는 병원과 같은 일부 기관의 의료인들이 치료에 있어 채식식단의 중요성을 아직 이해하지 못함에 따라 환자 치료에 어려움을 겪고 있습니다.
I've actually had the experience of having a patient, convincing them to be vegan. Then they needed a pacemaker. They came in the hospital, they stayed overnight, they were brought breakfast the next morning, and then when they came back to me, and I'm doing my food questionnaire, which I do on every patient, every visit, he says he was eating bacon and eggs. I said, well, what happened? He said, well, when I was in the hospital, that's what they fed me, and so I figured it was okay. Well, that undermines the nutritional guidelines that I had set for the patient, and his cholesterol was way high, and it's like, let's do better than this.
연구에 의하면 식물성 식단을 따르는 사람들은 육식을 하는 사람들보다 수명이 더 길고 심장병이나 당뇨병 그리고 많은 형태의 암에 걸릴 위험이 낮습니다. 윌리엄스 박사와 러시대학 의료센터는 비건, 완전 채식 식단이 많은 만성 질환을 예방한다는 정보를 널리 알리기 위해 적극적입니다.
It's really important to get data out there. So, we're doing videos and we're doing conferences, we're speaking to public. We do a lot of healthcare screenings at Rush, where we go out into a community, go out into a church group, and measure everyone's blood pressure, cholesterol, and their markers of diabetes. Assess the risk. We call it the HEART program, helping everyone assess risk today. Okay, and we do this in the hopes that we can impact their lifestyle once they know what their risks are. So knowledge is power here, and so yes, we want to have journals spreading the word to doctors. We want nurses, dietitians to be very knowledgeable, to have our hospitals, nutrition departments very knowledgeable. And it's a big task, but we're taking it on.
Do you have any messages for our viewers?
So what I would try to remind everybody is that we used to have TB sanatoriums all over the United States. We used to have iron lung for polio, victims. Well, what happened to all that? We figured out ways of getting around it. So, we talk about the labels on the cigarette package, the number of smokers going down. This is where we need to be with nutrition. Everybody needs to be knowledgeable, and we need to get rid of the diseases that are really plaguing our entire world that are based on diet and lifestyle.
채식을 지키는 것이 건강한 삶을 의미한다는 대중의 인식을 높이기 위해 열심히 애쓰는 킴 윌리엄스 박사님이 계시는 것이 우리에게 정말 행운입니다. 윌리엄스 박사님의 변함없는 헌신과 비건을 장려하는 노력에 찬사를 보냅니다. 킴 윌리엄스 박사에 대한 더 자세한 정보는 다음을 방문하세요. doctors.rush.edu